Hello, everyone. Welcome to our webinar. Today, we are going to talk about thyroid everything. My name is Dr. Tasman Cordy, and we're going to go through several simple strategies you need to know to understand how to eliminate your thyroid symptoms and to get started doing so. So welcome. I'm glad you're here, and let's get started. I am a doctor of chiropractic. I'm a certified functional medicine practitioner. My diploma was with the American Academy of Anti-Aging Medicine. And I have an advanced certification training in nutrition response testing, which is the main method I use in my practice to help patients via biofeedback get a good nutrition program started together and then follow them through their healing journey. I'm a certified yoga instructor, and I do use a lot of movement-based foundations as a chiropractor to help patients start exercise programs. A lot of patients with thyroid conditions are concerned about exercising, movement, and activity, and so that's part of my foundation and definitely part of how I help patients. And my bachelor's was in biology many years ago. In my private practice in Morganville, New Jersey, we help patients here in person. We also have a telehealth practice, so I help patients over the phone far away. We definitely do lots of dietary modifications in a really simple way. We do supplementation with nutrient, herbal, and homeopathic supplements. And again, different kinds of activities to help many people achieve their maximum potential. Sage Nutrition and Healing Center gets extraordinary results because we are dedicated to treating the person with the problem, not problems that come in with a person. Hypothyroidism affects 1 in 5 Americans, which seems like an insane number of people to be affected by the same condition. It's about 15 million people here. Another 10 to 25 million people may have subclinical hypothyroidism. And subclinical hypothyroidism may be diagnosed if you have no symptoms or very mild symptoms, compared with normal thyroid hormone levels or a very mild elevation in TSH levels. We'll look at that a lot of different ways. And we'll talk about how we're going to look at that in different ways so we can really understand how to help you improve your health if you've got maybe some symptoms, but not the classic high TSH levels. The symptoms of a low thyroid are all over the place. Some people have every single one of these, and some people have a few of these. But generally, people with a low thyroid function is a good way to think about that, are fatigued. They have trouble maintaining a healthy weight, or they gain weight easily. They have a puffy face, especially puffy under the eyes. They have trouble tolerating cold. They just don't get their blood all the way out to their fingers and toes, so they tend to be just really cold all the time, particularly in the wintertime or colder months. They have joint and muscle pain, constipation, because again, their GI tract is just too slow. It's not moving fast enough, and it gets really sluggish feeling. Their skin will be dry. Their hair will be dry. They don't sweat very much, or they just have decreased perspiration in general, both on a regular basis and also during exercise. They have heavy or irregular menstrual periods, and they have fertility problems because of just the low exhausted function. They tend to be more depressed than anxious, but I definitely see both depression and anxiety. The chemistry of depression and anxiety tends to overlap quite a bit. And so we'll see both of those things. It depends a little bit on just who the patient is and how they are in general, which one is kind of the most talked about or the most symptomatic for them. They'll have a slower heart rate, sometimes even down into the 40s. And sometimes they'll have a goiter, which is like a swollen thyroid gland. You'll be able to feel it really easily. We can always feel the thyroid gland right around the trachea in the front of the neck. It's actually a little bit lower than what's pictured on this slide, sort of right above the manubrium or right above the collarbones, but kind of in the middle of where she is and where your collarbone is on your chest is where your thyroid is, but sometimes it's very easy to feel because it's swollen. The thyroid produces the hormones T4 and T3. It seems like those are in the reverse order, but it produces more T4 than it does T3, which is why we talk about it like this. T4 is the inactive thyroid hormone, and T3 is the active thyroid hormone. And again, we'll get more into this as we move along here. This increases the metabolic rate. So when we have enough active thyroid hormone, it increases your metabolic rate, meaning all body cells work harder, which results in a higher body temperature, and not abnormally high, but just normal, high enough. In the 98s, 98.6 is normal. A lot of thyroid patients have a low body temperature. It results in a stronger and faster heartbeat. Oftentimes what I hear from my patients who have thyroid symptoms is that they have kind of a weak or slow heartbeat, and it feels like they can never quite get going. They'll have an increased breath rate, and again, increased meaning increased to a normal rate. Increased absorption of nutrients because the gut's working better, and when it works better, it absorbs nutrients better. And an increased gut motility. When we have overall normal function of the gut, it moves properly. So when you eat food today, it exits tomorrow. We don't want to keep food in the GI tract for days and even weeks at a time because your gut is moving really slowly. Well, a normal activation of the central nervous system, leading to higher cognitive function and quicker reflexes. Again, and this is a lot of times why people who have thyroid function problems or thyroid hormone balance problems complain of foggy thinking or slow thinking or sluggish thinking, or they complain of different kinds of attention issues, like they'll call it ADD or ADHD or OCD, and they'll kind of label it with different names. And that oftentimes comes from this place that the nervous system just isn't getting the proper support it needs and the proper hormone support that it needs from the thyroid. And so it's out of balance. And I think sometimes thinking about things as out of balance, whether it's too high or too low, is a better way to think about thyroid problems, because it's a really complex set of pathways that feed into how the thyroid works or doesn't work when it's out of balance. And then increased usage of food. This again goes back to simply breaking down food and absorbing nutrients through the GI tract better. So we're going to talk about getting the right tests, addressing SIBO, small intestine bacterial overgrowth. This can also be small intestine fungal overgrowth. So sometimes we'll say SIBO or SIFO. Really fundamentally just referring to the imbalance of bugs in the gut. We want to fix the other hormones. There's lots of hormones involved in balancing the thyroid, including thyroid hormones, but also including stress hormones, also including sex hormones, like estrogen, progesterone, testosterone, and we'll get into those a little bit more later, and I'll show you some examples of this. You'll definitely want to change your diet so it's well supportive, more nutrient dense. And then overall, we're really getting to the root cause of why this is an issue for you and repairing that, repairing the terrain that your gut works on, repairing the terrain that your tissues function well on, and repairing your fundamental behavior and dietary patterns that make you a healthier person. So first of all, we want to start by getting the right tests. A TSH level alone does not tell the whole story. So TSH stands for thyroid stimulating hormone. It's the most common test done in standard medicine practice looking at the thyroid. It's really a screening test. And so we always do this test. We want to see what it is. But it's not the only thing that we need to do to see how the thyroid is functioning and how it's interacting with the rest of the body. So the other tests that we'll do include free T3 and free T4, the active hormone and the inactive version of the thyroid hormone T4, reverse T3, antibodies to thyroid globulin and thyroid peroxidase, thyroid globulin itself, and then thyroid binding globulin. And these words are sort of a mouthful, and they all sound similar, but they all do very different things in the body. So we may need other tests beyond these. Oftentimes we'll need to look at bigger inflammatory markers that have more to do with how much inflammation is in the cardiovascular system, how much stress your body is under. So we might look at cortisol. And again, we'll mention this later, and we'll show you some examples of that and why that's important. And then definitely looking at sex hormones like estrogen, progesterone, testosterone, and a few other sex hormones that are important, and just making sure things are in balance and communicating well with the thyroid. So why is this long list of tests typically not mentioned, and why haven't you gotten these done before? Usually it's because we're just screening for overt disease in a medical practice. And once we have that, getting a thyroid healthier and better is a very functional process. And so a standard medical practice typically doesn't necessarily have the tools to handle the functional part of the project and process of getting your thyroid healthy again. So T3 or free T3 is the bioactive form of thyroid hormone. It's the one that we want to know how much you have because it's the one that touches your cells and makes changes happen. So it regulates body temperature, it regulates how the body metabolizes food for energy, regulates the heart rate, the health of the nerve cells, that nervous system cells, including brain and nerve cells all the way out to the fingertips and the toe tips. And then also regulates the synthesis of the neurotransmitters. Neurotransmitters are mostly made in the gut and they affect the brain. So gut health is important, brain health is important. They are combined and they're largely regulated by thyroid hormones. So serotonin is our happy hormone, norepinephrine is our stress regulation hormone, and then GABA is really a calming neurotransmitter. So we want to have enough GABA on board to remain calm. We want to have enough GABA on board to help us go to sleep at night. And all of these play a part in helping us regulate our mood. So oftentimes people who have an out of balance thyroid have out of balance mood stability. We also want to look at how much conversion is happening between T4 to T3. Again, most of what happens in the thyroid is the creation of T4, not T3. So we want to make sure you're actually converting 4 to 3 to get to that active hormone state. And that requires a mineral called selenium. Selenium is found, we'll talk about where it's found in a little bit, but it's found in lots of whole foods and it's really easy to get. But a low T3 status might tell us that you're just not getting enough selenium in your diet. And sometimes we need to supplement with that. I really like to do things through a whole food place, but sometimes we do need to supplement for a little while until the diet gets better and stronger. Zinc might also be the reason that you don't convert very well from T4 to T3. And so obviously knowing how much T3 you have is important compared to T4. If we have a normal T4 and a really low T3, there's probably a conversion issue. We can also take a look at your free T4, and free T4 might tell us, if it's really low, that you just have low iodine, so another mineral. The reason why I have a question on here that says, do you use sea salt, is oftentimes when people transition from using an iodized table salt, which is sodium chloride, to sea salt, which is not kind of the usual iodized version of the table salt, is that we've removed the iodine. So you're getting a nice healthy blend of normal minerals, but you're not getting that iodine anymore. And the farther away from eating seafood, which is high in iodine, to not eating that, we generally see that you have a lower iodine status, which is really important in managing thyroid conditions because the thyroid requires iodine to function properly and make thyroid hormone properly. So normal or high T4 combined with a low T3, again, may indicate that you don't convert very well from T4 to T3. Depending on why that is, it might change how we support and help you. The reverse T3 is the exact opposite of free T3, so it's biologically inactive. It looks like T3, but it doesn't work like it at all. It just blocks everything that's supposed to happen with normal free T3. That's really important to know that if you have high levels of reverse T3, it's important to know that they're high and you're probably not converting free T4 into the active form of T3. You may be converting it into reverse T3. There's a bunch of different reasons why that might happen, and I've listed them below. Sort of the obvious thing is stress. Stress makes everything worse. Inflammation, obesity, diabetes, food allergies, all these things are stress in a way in the system, and they'll increase the production of reverse T3. If you've got cellular injury, and we'll talk about leaky gut in a little bit here, but generally the inflammation from that doesn't allow us to convert the T4 to T3 very well, and we might make too much reverse T3. A low iron status, a low B12 status will also help us make too much of this reverse T3. And then certain medications will interfere with the proper conversion to the normal active version of T3. And that's important to know that because that depends, that will help us determine how we supplement or support you, whether it's with supplements and sometimes even medicines. So we check TSH, like I said, because it's the standard. It's not irrelevant. It's just not an independently reliable source of telling us how healthy your thyroid is. So it's part of the tapestry that weaves all of this information together as we collect all of it so we understand how to take care of you, what's missing and what's not. So it may be the primary issue, the thyroid, and it may not be. And so we need to make sure we're ruling that out properly by checking TSH. Normal lab values are typically between 0.3 and 3.0. Sometimes on an individual basis, this normal range is actually a little bit smaller than this, but that's fairly individual. And again, as a screening TSH, this is a good normal range or normal functional value to look at. So antibodies are our immune system responding to tissue in the body that it doesn't like. And this can also help us determine where the problem is coming from. So if your antibody levels against certain kinds of thyroid chemistry are higher in your system, it means your immune system is attacking itself in a certain way. And that will definitely help us understand why you don't feel well, and it will also help us understand what we can do for you and how much work we need to do in a certain direction to help calm and create a healthier immune system that responds more appropriately. Thyroglobulin is a storage protein for iodine. So if we don't have enough iodine, we probably don't have enough thyroglobulin. Globulin is the chemistry way to say protein. And so you may have low protein in general, and so you don't have enough thyroglobulin. You may have low protein and low iodine, so you don't have enough thyroglobulin, and you may have just low iodine. So again, depending on what these numbers look like really gives us an understanding of where the deficiency is or where the project is for us to really work on and handle. The other thing is that low levels may be caused by antibody production. So if your body is actively destroying thyroglobulin tissue, then we need to figure out, again, what to do to handle the immune system rather than just give you more protein or give you more iodine. Because if your body's going to destroy it anyways, because there's this antibody production issue or autoimmune condition happening, we need to handle that. Thyroid binding globulin transports T4 and T3 around the body. So if you think about thyroid binding globulin, or TBG, as the taxi cab that brings everything around the system, it's an easy way to think about what it does. If you don't have enough taxi cabs, we're probably not going to get thyroid hormone to the target tissue. And if the target tissue is your fingers and toes to keep them warm, you're probably not going to be very warm. And all of the other symptoms that we see with thyroid. Now, there's several things that will reduce thyroid binding globulin. If you have a lot of stress, that will reduce, and you make a lot of cortisol, that will reduce thyroid binding globulin. There's a variety of medications that can reduce thyroid binding globulin. And then low dietary protein can also cause a drop in thyroid binding globulin. Again, if you don't have enough protein dietarily or aren't digesting that protein very well, then you won't have enough nutrients to make a hormone like thyroid binding globulin or a carrier protein like thyroid binding globulin, because again, globulin just means a kind of protein. The second major tenet of handling any kind of thyroid condition is addressing SIBO. Again, it can be SIBO or SIFO. SIBO is a more commonly referred to acronym, which means small intestine bacterial overgrowth. In our colon, in our lower bowel or our large bowel, we should have lots and lots of good bacteria. A little bit fungus, a little bit this and that, but mostly all of the bacteria that we have down there should stay down there. We shouldn't have much bacteria or other infections or bugs basically in the small intestine. When we have a lot of infections in the small intestine or bacteria in the small intestine, that's when we start to get poor digestion problems, malabsorption problems. So you don't absorb things very well, you don't break them down very well. And nutrient deficiencies will result because you're not breaking food down, you're not absorbing it properly. So you're just not getting it into your general circulation so that it can go to the places in the system and rebuild tissue. So treating SIBO, if it is present, can be a really, really powerful thing to do to help patients feel better for lots of reasons. We know that SIBO produces very similar symptoms as hypothyroidism. And so if you have nutrient deficiencies because of SIBO, if you have nutrient deficiencies and it results in hypothyroidism, we're going to see really similar symptoms because of different causes. A lot of times they go hand in hand. Treating SIBO is a really important factor in controlling Hashimoto's disease. Any autoimmune condition is a multi-system answer to help handle it and fix it. But any autoimmune condition, we always handle what's happening in the gut first. And so I, in my practice, always look at food journals, and I look at those for a long time. There's not a lot of things that we can do on an individual basis that control everything in life, but I think we can control most things in our diet. And so by doing that, we need to figure out the things that trigger inflammation for you, and we need to remove those things. And the things that trigger inflammation for you might be the things that trigger Hashimoto's for you if you have those antibodies. Levothyroxine is T4. It's the synthetic or the medication version of T4, the thyroid hormone. And hypothyroidism are powerfully associated with SIBO in recent studies. So we're really just saying there's a correlation between taking levothyroxine, taking thyroid medicine, and also people who have small intestine bacterial overgrowth. There's a big overlap there. So if we treat one, we probably need to look at the other. And it's probably a chicken and egg situation. Sometimes we don't know which is the chicken and which is the egg, but we need to handle both of them and get both of them better. So we'll fix other hormones as well. And certain hormones may affect thyroid function, and poor thyroid function may affect other hormones. Again, whichever came first is less important, but handling all of the causes of the dysfunction is more important. And supporting all of those so your whole system can get better. So we'll look at DHEA, we'll look at cortisol, and we'll look at estrogen and progesterone. DHEA is an androgen, so it's in sort of the male hormone category, and it stands for dihydroepiandrosterone. It's an energy hormone, among other things. DHEA increases the efficacy of thyroid hormones, and so if you have normal iodine, but just low thyroid hormones in general, and you have really low DHEA, fixing the reason why you have low DHEA is the most important piece of this. But sometimes just supplementing with some DHEA will help you get better faster. We just need to figure out how to do that and at what amounts and for how long. Cortisol is our stress hormone. Patients with hypothyroidism often have abnormal cortisol levels, and it can be too high or too low, and that depends on a lot of other things. In part, and probably the most common thing that it depends on is how long you've had symptoms, whether it's too high or too low. But definitely low cortisol symptoms overlap significantly with low thyroid symptoms, and figuring out which is more important or figuring out how to help both at the same time is essential to getting the entire system functioning better. High cortisol, elevated cortisol, will shift the production of T4 into reverse T3. Again, we have elevated cortisol in situations of stress. That's why we produce it. That stress can be defined as blood sugar handling imbalances, emotional stress, lack of sleep. We produce cortisol for many, many reasons, and we produce too much of it for the same amount of reasons. So that can shift under those stressful situations, that can shift the production of T3 into reverse T3. And that shift can block the normal activity of active T3 and cause hypothyroidism looking symptoms. High cortisol will also lower thyroid binding globulin. Remember, that's our taxi cab that moves T4 and T3 around the body. So We can't move it around the body. We're going to have symptoms. And it's not always because we don't have enough of it. We'll definitely take a look at sex hormones. Most patients who have a thyroid imbalance also tell me about either cycling or menopausal symptom imbalances. Estrogen affects the thyroid, and estrogen typically affects the thyroid when it's not in balance with progesterone. If we have one word for estrogen that we would use in place of the word estrogen, it would be grow. And for progesterone, it would be nurture. And so we want enough growth sex hormone around, and we want enough nurturing sex hormone around. So when estrogen and progesterone are in balance, things feel pretty good. When estrogen is too high relative to progesterone, or progesterone is too low relative to estrogen, there's a situation called estrogen dominance that results. And if we have too much estrogen dominance, it leads to a cascade of different things that affect the thyroid, including problems with thyroid binding globulin, preventing thyroid hormone from being transported. So if you have enough thyroid binding globulin, that's great. If you have too much estrogen, you still won't carry around the T4 and the T3 and get them to the right places in the body. So even with normal thyroid levels, if you have too much estrogen and we're not looking at this, we won't uncover the reason for the imbalance. Progesterone, again, really is important in relation to estrogen. We never want to look at one hormone, one sex hormone especially, all by itself, because they all exist relative to one another, and that relativity is what tells us how healthy they are in a system or not, and how they're affecting a system. But progesterone is important because it's very nourishing. It should be higher in the second half of the menstrual cycle, between ovulation and when you start bleeding. If there's not enough, that's often why bleeding is heavier. And that's the one symptom that gets more with hypothyroidism. A lot of things get less and worse. And the bleeding during the menstrual cycle, when it's because of an estrogen dominance issue, particularly a progesterone deficiency problem, is when we see heavy bleeding during cycles, heavy bleeding, clotting, long bleeding cycles. Number 4 is change your diet. And diet is absolutely the most overlooked component in people with hypothyroidism, but I will clearly say that diet is the most overlooked component in people with any symptom of any kind. And this is what I see that is missed the most in not just Western medicine, but all healthcare is really missing a high quality diet with good nutrient absorption, which results in a healthier body. So if you don't have a healthy diet and there's poor quality there, we're going to result with poor nutrient profiles and poor thyroid function. Specifically, we can consider some nutrients and where they come from to understand what helps the thyroid. So carnitine is an amino acid, and if we have really low levels of carnitine, that can contribute to muscle fatigue, which is a common thyroid problem, is just general muscle fatigue. And sometimes that's only reported by patients in that they say, my heart feels tired and weak and doesn't beat very well. And that goes back to those initial lists of symptoms that we say a lot of thyroid patients have, which is a low heart rate or a low pulse. Vegetarians, definitely need to be aware of this because low protein sources will lead to low carnitine. Asparagine is another amino acid. It's found in similar things as carnitine because it's a protein. Complete proteins allow us to get all of the essential amino acids, including these two. Asparagine is part of the structure of thyroid stimulating hormone. So thyroid stimulating hormone, or TSH, comes from the pituitary and goes down to the thyroid and tells the thyroid to do work, like create T4 and a little bit of T3. And if we don't have enough asparagine, we're not even making that hormone to come from the pituitary to tell the thyroid what to do. We're going to have a low or inappropriate numbers of TSH, which will be really confusing if it's just an overt nutrient deficiency because of a low protein diet. Iodine is a part of the thyroid hormone. Again, I want to come back to this because I do think it's important that when we see increased uses of sea salt without added iodine, we'll see more iodine deficiency. So we do need to test your levels and see where you are. And the easiest way to support an iodine deficiency is to give you more seafood. And we can specifically supplement with iodine and really well absorbed iodine products to help this. Usually that's a shorter term thing, but it really depends again on how much seafood and seaweed you're eating in a regular diet for you. Selenium is a mineral. It's another mineral along with zinc at the bottom here. Selenium helps that conversion. We mentioned this earlier from T4 to T3. And we get selenium from really concentrated food sources, grass-fed beef, seafood. Brazil nuts is a really good place to get selenium. You need 1 or 2 a day to have enough for your whole day. Vitamin A is a hormone. We talk about vitamin A like a vitamin, but it's a hormone. The best source is cod liver oil and eggs. But we can get the precursors, the things that eventually make vitamin A, from orange and yellow fruits and vegetables. Vitamin A helps activate the gene that regulates TSH. So it really works with the pituitary to make TSH and to make the thyroid from the top down work properly. And then there's zinc, and again, zinc increases T3 and in zinc deficient people. It's a nutrient that's often lost with food processing. Zinc is a common nutrient or a common mineral found in a lot of the same things I've already mentioned. The concentrated forms of meats, poultry, oysters, nuts, and beans. General dietary advice. I don't love general dietary advice because it sounds a lot of the same, but these are the important things as it relates specifically to thyroid hormones. Eating a whole, minimally processed food diet is going to be best. Protein, vegetables, fats, and water and salads is really like the 5 big things that I emphasize for my patients. And knowing your iodine status is very important. Some people get iodine from places they don't even know, and so they're doing fine with it. And some people are profoundly low, and we really need to supplement in a really strong way for a while to get back to at least normal levels. In people with low iodine, I get this question often, so I put it on here. Cruciferous vegetables in their raw form can interfere with thyroid function, but you have to eat enormous doses of broccoli to suppress thyroid function because of some of the chemistry that's in these cruciferous vegetables. So I really want my patients to be eating these, typically eating them in a sort of a steamed or souped or stewed kind of fashion, or sauteed fashion rather than raw. But to worry about suppressing thyroid function because of this is generally not a concern. It's really like pounds a day you need to be eating. However, avoiding soy is really important. I don't think soy is a food for people, and it generally suppresses thyroid function, and it also suppresses most endocrine function. It's too hard to find good sources of soy that are really healthy and helpful that it's so much easier to just replace it with something else and get what you need from other more nutrient-dense foods that don't block thyroid function and certainly don't block endocrine function. And then millet is a grain. It simply suppresses thyroid function. It's a grain you sort of have to work to find or work to get, and so it's pretty easy to avoid, I think. But some people will show up, and some patients will show up already eating it for some particular reason. They found a bread that they like with it or something. So definitely, it's just an easy thing to avoid, and I think it's an easy way to generally change your diet to support thyroid function. So obviously, we're getting to the root cause by looking at all of this, and the root cause is where all of this is going to be corrected. If you have Hashimoto's disease, which is an autoimmune condition, fixing your immune system and fixing your thyroid is going to start in your gut. It's going to start there every time, and we're going to look at that for a long time. Because it takes a while for those tissues to turn over and your immune system to calm down. If you're a poor converter of 4 to 3, it tells us a little bit more about where the problems are coming from. But if we're just going to add more T4, that's not usually going to be very helpful, even though that's the typical recommendation from medicine is to give you levothyroxine and just give you more T4. But if you're not converting, we're not going to get anywhere with it, especially if you're converting it incorrectly into the reverse T3 form, because if you have too much stress, you're making too much cortisol, you're going to do that downstream pathway incorrectly. So it may be that you need to add more T3. If you're estrogen dominant, this dominance will continue to adversely affect your thyroid function. Adding more thyroid hormone won't help until we balance the estrogens and the progesterones. And if it's a detox situation, you're not breaking down excess estrogen or the estrogen byproducts in your liver, that will affect the thyroid. And if you're not eliminating what you're detoxing through your bowels, that will also affect thyroid function. We definitely look at chronic inflammation, and we need to look at where the inflammation is coming from and what's breaking down as a result of it. Checking blood markers like highly sensitive CRP or homocysteine. I check other markers like LPPLA2, which is a blood vessel inflammation marker. We might need to look at other blood sugar handling markers like hemoglobin A1C and fasting glucose to understand where inflammation or where imbalance is coming from. Managing your stress is a huge piece of improving your health. Normal physiologic response to stress, which might even be as simple as not sleeping enough last week, affects thyroid function. It can affect blood sugar handling, and it can affect your cortisol levels. Sometimes we need to do evaluations of cortisol by doing a saliva test, is how I best look at that, because cortisol levels should be higher in the morning and decrease throughout the day. And if your cortisol levels are low in the morning and high at night, we really need to understand how your patterns are during the day. And so that has a lot to do with circadian rhythms, but it also has a lot to do with how you're taking care of yourself. So let's go through a few case studies. And really what I want you to see on these case studies is that these patients all presented with basically the same symptom, but the result of the testing that we did and the process of getting them better was very different. We're just going to look at, again, what their labs look like at the beginning. So this person showed up with normal TSH, a couple of years symptoms of hypothyroid symptoms, but elevated reverse T3. So probably a lot of stress, probably not converting very well, and most likely due to a leaky gut and some other things. This patient, again, normal TSH, hypothyroid symptoms, they had low T4, they had low free T4, and then their free T3 was low normal, but they're both low, and then thyroid binding globulin is also low. This patient, again, optimal TSH levels, 0.6, that usually feels really good for a lot of patients. Their total T4 was low, their free T3 is low, and their thyroid binding globulin is also low. So again, really different presentation, pretty similar on labs, on data, but pretty similar symptoms. So we need to handle this in really different ways. We included some sex hormones on this one. Same thing in terms of hypothyroid symptoms, but the patient turned out to have very high estrogen, high progesterone, and high testosterone levels, high cortisol levels, and the TSH was high to start with. That got better over time. As you can see, the progress of this. We take care of lots of different patients with all kinds of symptoms in my practice. Some of them have overt thyroid symptoms. Some of them it's thyroid and lots of other things. And that's way more typical, is to have maybe a thyroid problem, but lots of other stuff. And this patient really had a lot of GI symptoms and is doing well. This patient had hypothyroidism. Pregnancy made everything remarkably worse in a way that really affected her mood, brain, and her energy patterns. We take care of a lot of other practitioners, And we sort of share a lot of patients with other practitioners because we do this really well, but I definitely am not an acupuncturist. I'm not a prescribing physician. There's a lot of other things that need to happen in patients' health journeys to come together to take care of patients really well. And I think this is a good example of this. This patient showed up with a lot of hypothyroid symptoms, but was ultimately diagnosed with rheumatoid arthritis, which is an autoimmune condition, and has done amazingly well with really getting diet and lifestyle back on track, in addition to watching all of these hormones get better and better over time. And this is one of my very long-term patients from years and years ago, almost 20 years ago. And most of what keeps her well and has gotten her well over time is her diet and lifestyle and getting those tuned into what she needs rather than a certain kind of diet or a certain kind of lifestyle. She's really over time figured this out, what works best for her. And I think that's one of the takeaways from this is that everyone's condition, everyone's symptomatology is similar but individual. And the way we need to handle it is very individual every time. So our gift for you for being here today is certainly a free consultation in the office. A new patient package, if you want to move forward after that consultation, includes a full medical history, a full nutrition evaluation and dietary plan, supplement recommendations to assist in reducing your thyroid symptoms. We will do a free hormone trio profile, which is typically a $130 value with the purchase of that comprehensive new patient package. And we'll do a prescription for individualized blood work, including a complete thyroid panel. Additionally, we'll do a chiropractic assessment and a cardiovascular and neurological test. If you're an established patient, you can receive $100 off a comprehensive thyroid profile, which is usually $319. These are all of our contacts. Our website is just my full name, tasmancordy.com. Our email is hello@tasmancordy.com. And our office number is 732-443-0300. I'm going to send you a link to our Calendly page if you're interested in making an appointment to come in the office for that free consultation. It'll take between 15 and 30 minutes. And we can talk about really what's happened to you and where you've been, and then where we start with something like the symptoms that you've talked about for yourself. I'd like to thank you for being here today. I hope you learned something. And if you need more help, I hope we're able to help as soon as possible. Thank you. Have a great rest of your day. We'll see you soon.